Hi, this is Tombash from Cincinnati Children's Hospital. In previous video, we introduced the concept of 3D printing. In this video, we'll discuss the way to apply 3D printing in healthcare with some examples. Let's get started. Personalized medicine, also noted as precision medicine, is a medical model in which physicians use diagnostic tests to figure out which medical treatments will work best for every patient. New tools and advanced technologies like genome editing, artificial intelligence, wearables, and 3D printing are important for improving this model. Medical devices produced by 3D printing include orthopedic and cranial implants, dental restorations, external prosthetics like hands and legs, and surgical instruments such as forceps, hemostats, scalpel handles, and clamps. With 3D printing, some devices are printed from a typical design to create multiple identical copies of identical device. Other devices, called patient-specific devices, are created from a particular patient's imaging data. And there's one more exciting application of 3D printing, which is creating patient-specific organ replicas that surgeons can use to practice on before performing complicated operations. This technique has been proven to speed up procedures and minimize trauma for patients. Also, 3D printing can be used for pharma industry, and according to this paper, the rapid advancement of 3D printing technologies could move the pharmaceutical production from mass manufacture to on-demand, personalized dosage forms, which would provide patients with more safe and effective medicine. And in case you were wondering how far we're from 3D printing living organs, scientists are researching the way to use the 3D printing to manufacture living organs like a heart or a liver, but this research is in early stages of development, according to the FDA. Download the Stay Current app, follow us on social media, and subscribe on YouTube channel. And remember, knowledge should be free.